is to provide food and medications for the patient who cannot eat, who cannot take food or medication by his mouth. Maybe he is an unconscious patient and he have a lockjaw and he is a pregnant pre-infant, and also he has just have oral disease or have oral operation. So we should insert a tube from his nose into his stomach. When we do this procedure, we also have two assessments. First, assess the patient's age, level of consciousness, and health condition, and whether he can communicate with you. And the second one is we should assess the patient's whether he can cough or swallow. And we have to check his nose, whether they have membranes and mucosa, or he has derivation of the septum. And we also take the patient, position the patient to the right position. It depends on the patient's consciousness. If he is a consciousness patient, he just sit on bed, sit down. And if he is unconscious patient, he just lie down and remove the pillow. Don't use the pillow. Remove the pillow, and let his hand, let his chin upward. And this is the stomach tube. All the equipment is in there, and we also need stethoscope to check whether the tube is in the stomach, and check the patient's nostril. And the sideline is to rinse his nose. And there has a cold water box. There have three methods to check the tube whether it's in the stomach or not. So we need to prepare this one and this one, and also a sealing in this one, in there. Choose one of nostril. Of course, you have to wash hands in 7 steps. He is an unconscious patient, so she just lie down and remove the pillow. Okay, can help me to take off the button.
They're practicing.
Or maybe someone is practicing?
Yeah, they're practicing.
Okay. Wear a glove. Okay. Place the strap under the patient's chin. And don't put it like this. You have to protect your two hands, not to touch the patient, like this, and then place it like this. Okay? You can also put a kidney basin under his chin, if it's necessary. And before we insert the tube, we also have to check the tube. It's for infant. It's so big. It's just for infant. And we have to measure the lungs from the nose to the earlobe and then to the xiphox. It's like this and like this. This is the lungs. And the second method is just from his hair end to the xiphox. So it's this. Just use it. And check the tube is obstructed or not. just like that. You can use and lubricate the tube with lubricant. If this tube is not clean, you should change another one. For adult, the length of insertion is 45 to 55 centimeter, and for adult, for children, it's always 35 to 40. It depends on the patient. If it's for infant, you just measure the length. And then insert the tube from the selected nose strip, and insert it gently. When you insert in 15 centimeter, ask the patient to swallow. As if he's a consciousness patient. If he's an unconsciousness patient, when you insert at 20, just let his head up and let the chin touch the chest. And then this one, and then insert. If patient have a suddenly cough or feel or you cannot insert fluently, you have to ask the patient to open his mouth to see whether the tube is obstructed in his throat. And if he cough heavily, you have to withdraw the tube and ask the patient to have a rest. That means the tube is in trachea. And for the consciousness patient, when you ask him to swallow, and as he's swallowing, you insert, swallow, insert, swallow, insert, until to the right lungs, and then tape the tube. This is the first tape. And right now, we also take the second in his earlobe to protect the tube withdraws accidentally. And then there has a cap. It has to cover it. And this free tip of the tube you can cover with gums and with glass. And then ask the patient. When we insert it, we have to check the tube whether it's in his stomach or not. We have three methods. First one is just insert the free tip of the tube into a cold water and see whether they have bubbles. As he breathing, there's no bubbles, means the tube is in stomach. If the tube is in trachea, as he breathing, it will have bubbles. And this first one. And the second one is to withdraw fluid from the stomach. If you got fluid, it means in stomach. Because in trachea they have no fluid. And the second, and the third is use a stethoscope. Put the stethoscope in stomach area and you need to call another nurse or your colleague to help you to insert some atmosphere from the tube. Okay, help me just put there and insert 10 to 15 millimeter atmosphere quickly, and there you will see bubble sound. That means in stomach. The showing my.
Do it again.
That's bubble sound. If you don't hear the sound, it means the tube is not in the stomach. You have to choose. You'd better choose two methods to check whether the tube is in the stomach or not. And then study the UT machine and throw it in the medical waste bag and make a record. That's all the process I have teaching. And you